Addiction is a complex psychological process that manifests in any behavior that a person enjoys, finds relief in, and craves in the short term, despite suffering negative consequences in the long term. It is not limited to substances such as cocaine, heroin, alcohol, nicotine. It can also be related to behaviors such as sex, gambling, shopping, eating, internet relationships. Now, while the official definition of addiction views it as a primary brain disorder caused by genetic reasons, I believe it's much more complex than that. As human beings, we have two fundamental needs: attachment and authenticity. Attachment refers to the closeness and proximity to another human being for the purpose of being looked after or looking after others. I think it's essential for our survival and is facilitated by endorphins, which are the body's internal opiate-making chemicals. Without attachment, we cannot thrive. Attachment is a fundamental human need that begins in infancy and continues throughout our lives. It is the emotional bond we form with our caregivers or significant others. It's this which provides us a sense of security, support, and love. Without attachment, we would struggle to survive and thrive. In infancy, attachment is crucial for our physical and emotional well-being as we rely on others to meet our basic needs. Authenticity, on the other hand, now that refers to being true to ourselves and acting in alignment with our genuine thoughts, feelings, and values. It involves being in touch with our intuition and gut instincts. When we are authentic, we make or can make decisions that align with our true selves and lead us to a sense of fulfillment and well-being. However, when our authentic selves, our authenticity threatens our attachment relationships, such as when expressing anger as a child leads to harsh treatment from parents, we learn to suppress ourselves and our true feelings. This conflict between attachment and authenticity can and does cause us to lose connection with ourselves and our gut feelings. However, there can be a conflict between attachment and authenticity, especially when our authentic expression threatens our attachment relationship. For example, if you think about, as a child, we express anger or assertiveness, but our parents respond with harsh discipline or rejection. If this were the case, we may learn to suppress our true emotions and needs to maintain the attachment. This suppression can lead to a disconnection from ourselves and a loss of authenticity. Trauma plays a significant role in this disconnection. Traumatic events such as abuse, neglect, or witnessing violence can also disrupt our sense of safety and overwhelm our ability to cope. As a result, we may disconnect from our emotions and our bodies. We do this as a way to protect ourselves. This disconnection can manifest as numbing disassociation or avoidance, making it challenging to be in the moment, present, engaging with our authentic selves. In the context of addiction, Individuals often turn to substances or behaviours as a temporary solution to cope with the pain of disconnection caused by trauma. Drugs, alcohol, or addictive behaviours can and do provide relief, numbing or brief sense of connection. However, these coping mechanisms ultimately perpetuate the cycle of negative consequences, reinforcing the need for addictive behaviour. This conflict, which is essential for survival in a natural setting, becomes a threat to our survival in modern society. We give up our authenticity to maintain attachment, leading to a loss of identity and a disconnection from ourselves, which is lost to those around us, those that need us. Now, to heal and to reconnect, we must address the childhood pain and trauma that caused the conflict. Trauma is not just about external events, but about what happens inside us as a result of those events. It disconnects us from our emotions, our bodies, and the present moment, shaping negative views of ourselves and the world around us. Addiction is not the primary problem, but an attempt to solve the problems caused by childhood trauma. However, it creates more problems in the long term. Recovery involves reconnecting with ourselves, restoring the connection with our bodies and emotions, and finding ourselves again. The goal of addiction treatment and mental health treatment is not just to recognize past events, but to recognize their present manifestations and transcend them by re-establishing the connection with ourselves. And by doing that, we can recover and find our true selves once again, healing the wounds of trauma and restoring our connection with our bodies and our true selves is no one-size-fits-all. It's a journey that when you get to the true root cause of the problem, you can re-establish that healthy attachment to ourselves and others, and we can find a sense of safety, support, and love that allows us to reconnect with our authentic selves, benefiting those that we serve. And recovery is not just about abstaining from addictive behaviours, but about rediscovering who we are and cultivating a meaningful life from then. Everyone is on a journey, and the journey of recovery is unique. Each person's trauma, the attachment patterns, and individual needs must be considered on a case-by-case, healing-by-healing process. Recognizing the roots of addiction in childhood trauma and focusing on reconnecting with ourselves, we can then move forward to lasting recovery and a happier, internal, more fulfilling life.